to a conference for parent carers of children with disabilities. And I was in a workshop where families were talking about the difficulty they sometimes had accessing the services and resources they needed to support them. And quite suddenly, one of the mothers there said, "Paediatricians, I hate all of them." And I could see that there was quite a lot of embarrassment, and some of my professional colleagues looked really shocked. But frankly, I wasn't shocked. I could understand why this mother would see them as the enemy. And that was because I could remember being exactly that angry and hurt. In 1979, I became the single parent of Sam, a child with chronic illness. And that was the beginning of a long and close relationship with health and social care services. From the outset, I recognised that those services and the behaviour of the people working in them could be experienced as mechanical and disempowering for parents, and particularly for single parents from poorer communities. This was brought home really forcefully to me when Sam was just a few weeks old. He hadn't been putting on weight, what the doctors called failure to thrive. So they decided they wanted to put a tube down into his stomach and feed him through that, so they could measure exactly how much milk he was taking. That was fine, but I sort of assumed that I'd be part of that process. But they said no, literally closing the treatment room door in my face. And not only that, they told me that if I argued, if I questioned their judgment, they would start custody proceedings against me, and I risked losing my child. I was outraged and baffled, but I left the ward and I went downstairs to the waiting room where there was the one payphone in the hospital, and I called a friend of mine who was a solicitor and asked for legal advice. But her advice to me was that actually, if a judge was told that I ignored or questioned medical advice, the likelihood was that I would lose custody of my child. From my perspective, it seemed that this welfare machine and the doctors who were in the driving seat had been deliberately designed to rob me of any choice and control. And Sam and I, actually, we got very skilled at navigating through this system over the years, but this was far from the last time that healthcare professionals behaved in a way that undermined, infantilized, and disempowered me as a parent. And these weren't bad people. I could see they were really well-meaning most of the time. And they were the same people who were capable of acts of real kindness towards us too. But often, their behaviour towards me as a parent and behaviour that I witnessed towards other parents could be devastatingly disempowering. And I really found this very hard to understand. Who did they think they were? And it was something that I didn't come to understand for more than 20 years. After Sam had died, I went to university and studied social sciences. And it was there that I read for the first time works written by the people my friend Mary always respectfully refers to as the Dobbs, the dead old blokes. And I had a sudden revelation, and the work that most illuminated my own experience was this one, Plato's Republic. You may not have read this one. I do recommend it. It's the story of how the philosopher Socrates searches for the meaning of justice. And he does this by creating a model of an imaginary town. And I better issue a spoiler alert, so if you don't want to know the ending, cover your ears here. What Socrates decides is that the city is just if everybody is doing the work that they're best suited to do. That everybody knows their place and the minions don't get uppity. So the golden ones rule, the people made of bronze get to do the admin, and those of base metal do the donkey work. And Socrates goes on to argue that these golden ones, the leaders, the city guardians, are perfectly justified to manipulate and lie to the underlings, if that's what it takes to maintain the social order and to stop them getting ideas above their station. As soon as I read about these wonderful golden leaders, I immediately had an image of this host of well-polished and patronising doctors and officials that Sam and I had done battle with over the years. That's who they thought they were. And it made sense because the sort of schools that people who designed and ran health and social care services would have gone to would have taught this stuff. And even if they'd not been taught it directly, their teachers would have read Plato. So they'd been trained to be those golden ones, with this privileged insight into what was good for everyone, and a responsibility to make it happen. And let's face it, training as a medic or working as a civil servant wasn't likely to make you feel less superior. And it made sense when I realised that it was possible for doctors to see what they were doing as this. And a huge communication gap was bound to open up when what patients, parents, families experienced tended to feel more like this. And this gulf in communication was starkly exposed during the UK government public inquiry into what went wrong with children's cardiac surgery in Bristol in the late 1980s, early 1990s. Evidence to what became known as the Kennedy inquiry made it clear that children's hospitals across the country had been retaining organs from children that died in their care. And they'd used them for research and mainly for teaching purposes. But they'd been doing this routinely without properly informing, let alone asking permission from the parents. The inquiry was told that the reason that healthcare professionals hadn't asked parents or explained to them what specimens might be retained was they hadn't wanted to upset them at a time when they were vulnerable. If that was the case, these clinicians and managers had completely failed to understand how much more upsetting it would be for parents to find this out at a later date, sometimes years after their child's funeral. Even families who said they would have happily donated organs had they been asked were devastated by finding this out too late. So by failing to discuss this notion of organ retention, by not discussing it openly, the behaviour of healthcare professionals was experienced not as caring, but as a breach of trust, as dishonest. The report to Parliament of the Kennedy inquiry emphasises very heavily the need to use more transparent methods and openness to make sure you bridge that communication gap between people using health services and those who work within them. And it has a whole chapter in there on the role of patient and public involvement in helping to make that happen. And this report was one of a number of drivers that led the UK's National Institute for Health Research, the NIHR, when it was founded shortly afterwards, to also found roles for lay representatives in health research. And this was a massive opportunity for me because it gave me the chance of using those very painful, difficult, negative experiences that Sam and I had had together and transforming them into something that was useful, that was positive, that was really helpful. So, since 2004, I've worked with the NIHR in a number of different roles. And initially, I was a lay assessor on research funding panels, helping to judge the value of health research from the perspective of a carer. And then in 2011, I had the opportunity to do a PhD study funded by the NIHR Collaboration for Leadership in Applied Health Research and Care, Southwest Peninsula. A mouthful that I can luckily contract to PenCLAHRC. And my study with PenCLAHRC involved talking to lots of other people who'd been in lay roles in health research. And their stories were really deeply inspiring to me. One patient activist I spoke to, who herself had been very much harmed, told me I had to speak out. I felt driven. People thought I was wonderful, but I was just driven. And she'd gone on to hear other stories and to speak out about them, and she'd found who she called the good guys in the system as allies who she worked with to make change. Her story of starting from a position of feeling voiceless in a mechanical system really resonated with me. And it made me realise that having found my own voice, I have a responsibility to help other voices get heard. Because I, in turn, had support from many other people. So, since 2014, I've worked with the PenCLAHRC Public Involvement Team at the University of Exeter. And my work focuses on bridging those communication gaps. So it's about making sure research addresses the questions that actually matter to people using services. And that research evidence is available and accessible to people who might want to use it in their own personal health decisions. So it's shaping services that are responsive to the needs of the people who are using them and that listen to and respect the stories that actually matter to people. So I work with clinicians, with researchers. These are the Cornwall Health Librarians and the Health and Environment Public Engagement Group. I work with members of the public and even paediatricians. In fact, my boss is a paediatrician. And between us, we're pushing open those doors that used to stand between those who know things and those who have things known about them. So we can see each other more clearly, reach mutual understandings, and hopefully create services that really can care. Thank you.